You're listening to an ENN podcast.
Hi everyone and welcome to this podcast. This podcast accompanies an article in Nutrition Exchange issue 9 called A Catalyst for Scale-Up in Sun Countries, Experiences of Technical Assistance for Tajikistan and the Philippines. With efforts being made by countries around the world to scale up efforts to reduce malnutrition, there's a recognized need for technical assistance to enable and support countries to engage in the often very complex processes or transitions that are required. One program that has been providing technical assistance to Sun countries is the TAN program, Technical Assistance for Nutrition, which is funded by the Department for International Development. The TAN has two implementing partners. One is Nutrition International, based in Canada, and the other is the MQ-Sun Plus Consortium with the leader agency PART, based in DC. And this podcast is the first of two in which we speak to members of the TAN TA teams to hear about two specific TAs that they've been involved in the last year, one in Tajikistan and one in the Philippines. And on this podcast, we speak to members of the global TAN teams, and on the second, we'll speak to members of the regional and country level teams who are involved in these TAs. So I'd like to start by introducing my two guests on this podcast. We have from the Global TAN team at Nutrition International, Loretta McKinnon, the Program Director. Welcome, Loretta.
Thank you very much for having me, Tui. It's a pleasure to be here.
And from PART, the lead agency of the MQ-Sun Plus Consortium, we have Monica Kothari. Welcome, Monica.
Thank you, Tui. Hi, everyone. Just to add, MQ-Sun stands for Maximizing Quality of Scaling Up Nutrition.
Before we start, it would be good to mention briefly what the referral or request process is for TA for Sun countries, as some of the people listening to this podcast might be interested in accessing TAN TA after hearing this. So Loretta or Monica, is there anything you can share with us about the process you use in taking requests for TA, or what mechanisms you have in place for generating technical assistance requests?
This is Loretta here. Just to say that our Nutrition International TAN regional teams, they've been visiting the 20 Sun countries that Nutrition International provides technical assistance support to under the TAN project, doing an engagement with in-country nutrition partners, trying to coordinate meetings with the multi-stakeholder and multi-sectoral platforms at country level. And that's to reinforce the mechanism under the movement, to have those discussions with as broad a group of people as possible. So a lot of the TA requests that we receive and prioritize for support by Nutrition International through TAN come directly from those in-country engagement discussions. So it's through our TAN team and liaising closely with the focal points in each of those 20 countries. Those requests get prioritized for support through us in that mechanism. We also support the Scaling Up Nutrition Movement Secretariat with specific pieces of TA as well. So there's two slightly different mechanisms for Nutrition International under TAN, one through direct country engagement via the focal point and multi-stakeholder platforms, and the other through the Secretariat through direct requests from staff at the Secretariat in Geneva.
Thanks, Loretta. That's really clear. Now, Monica, the MQ-Sun Plus mechanism works a bit differently, as it's a consortium of partners and doesn't work so much through this network of country offices. So can you tell us about the way in which MQ-Sun Plus takes requests?
So for the MQ-Sun side, usually 100% of our requests come via the Scaling Up Nutrition Secretariat that is based in Geneva. MQ-Sun Plus mandate is when there is no provider at the country level that can respond to the request, that request is sent to the Secretariat through the Sun focal point, and SMS reviews that request and they mobilize the technical assistance providers who can respond to these requests. So usually through this mechanism, most of the time, MQ-Sun Plus is identified as the technical assistance provider to provide assistance in the request that has been asked by the Sun focal point. As you already mentioned at the beginning, the type of request can be varied, either just reviewing a national nutrition policy or action plan, actually developing the national nutrition policy or plan, working on developing a common results framework, supporting costing exercise, budgeting activities, etc. So once this request is received by MQ-Sun Plus, we start engaging with the Sun focal point and other stakeholders. Usually in our case, when we receive the request, it is still not in the form of a terms of reference or any kind of scope of work. So when we receive the approval from DFID, we are ready to launch the TA within like a week or 2 weeks, depending on the readiness of the country. And the TA could be a short-term TA that less than 30 days, could be a medium-term TA, 30 to 60 days, and long-term TA as well, which could go up to 2 years, as currently in the case of Tajikistan. So this is the process for responding to the technical assistance for the countries via the Secretariat. In addition to that, we also provide technical support to the Global Scaling Up Nutrition Secretariat in the areas of providing guidelines on doing activities at the country level or anything else that they need help with in conducting workshops or trainings or any other technical assistance needs that the Secretariat has. Thank you.
So as part of this set of 2 podcasts, as I mentioned earlier, we will be talking to 2 of the colleagues that worked quite closely on the 2 TAs covered in this article at the regional and country level. But it will also be really useful to get the perspectives from both of you who are members of the global TAN teams. So Monica, can you tell us a bit about the work that MQ-Sun Plus has done in Tajikistan to start off?
So MQ-Sun has been providing technical assistance to Tajikistan since 2015. We started working with Tajikistan to do a initial gap analysis for their policy review for their Sun work. And while doing the gap analysis, they identified what they wanted to do in terms of multi-sectoral planning. We also did a stakeholder mapping for Tajikistan to help them identify who are the key stakeholders for nutrition in Tajikistan. After providing these 2 technical assistance, Tajikistan requested a further scope of work to support them for developing a common results framework for them, which is the technical assistance that we have been providing them since the beginning of 2017. So we drafted a common results framework for Tajikistan by the mid-2017. And now currently we are helping Tajikistan to operationalize that common results framework. So getting back to your question about what is a common results framework. Also, countries need to define a population in which they want to see the improvements while developing the common results framework. And usually the countries have started selecting either the first 1,000 days or children 0 to 59 months of age. Also, countries try to identify interventions that are necessary to achieve the results and clear indication on current coverage for the levels of those indicators. And very key element of common results framework is the identified responsibilities of line ministries and sectors within the government for implementing the interventions that are identified in the common results framework, and also to identify roles and responsibilities of non-government partners.
Thanks, Monica. I'm sure we'll hear more about the specifics of the Tajikistan experience from the local consultant, Motriba, who was working for MQ-Sun Plus on that TA. And Loretta, I was going to ask if you had anything to add about the Common Results Framework or some of the things that Monica has referred to. I'm referring to the experience that the NI-TAN team has had with the National Plan of Action in the Philippines.
Thanks very much, Tui. It's the technical assistance that Nutrition International provided to the government of the Philippines to help them develop and cost their new Philippines Plan of Action for Nutrition for the next 6 years. Some of the initial work that was done by the team of Filipino consultants who were contracted to do this work led to the Common Results Framework being better informed, and that involved a very in-depth and consultative landscape analysis of the situation in the country, which I think informed the Common Results Framework, but also led to, I think, a very practical, a very broad, and a very locally owned plan of action for nutrition. There was a lot of in-depth consultation and validation meetings that were conducted as part of this technical assistance. We had lots of focus group discussions across different islands in the country, many regions, many provinces, different cities and municipalities. There was lots of key informant interviews, various multi-sectoral consultations, and validation meetings. So a lot of this information better informed different programs that were underway, including the development of the Common Results Framework. I think a key feature of the technical assistance to develop the PPAN by Nutrition International was using very experienced, very informed, and very connected local consultants who were able to do work at the grassroots level all the way up to the national level. So I think the fact that it was very consultative really helped build ownership of the plan by the people who were involved in all of these meetings and discussions. So I think the collaborative and consultative approach with a really wide range of stakeholders was a really interesting feature of this technical assistance, and one I think that led to the success. So what the government now has is a 6-year plan that will be implemented by the National Nutrition Council and other partners, including government agencies, the local government units, NGOs, institutions, and development partners, is something that people have bought into. People see their role in the development and as well their role in the accountability and the responsibility to make sure that the PPAN gets implemented effectively. So I think being able to recruit experienced and respected consultants who are very informed about the local contextual situation as well as nutrition more broadly, and involving people at all stages of the technical assistance really made this effective. One of the quotes that we received from one of the national government representatives when we were doing an evaluation of this technical assistance was that the PPAN development process itself became a platform where stakeholders were able to raise issues of how and what to implement. The whole process was inclusive, and to them that was very important. So I think that's a really interesting feature of this technical assistance that we've provided. So in addition to leading to the development of a costed, specific national plan of action for nutrition, it raised awareness and built capacity on nutrition more broadly at multiple levels, but also supported the development of the costed the CRF. Thank you.
Thanks, Loretta. We look forward to hearing from Manpreet from the Nutrition International regional team, who's also working closely on that TA in 2017. So just moving to the next question, maybe Monica, we can hear from you first on this. We're interested to hear more about the role of government leadership in the delivery of TA and how that relates to the success